I'm here going to tell you about a research project I did for my class on futures research. The research project begins with a 16-year-old girl asking the question, why can't I read? Now, this girl is not stupid. She's a very bright little girl. She's good with mathematics. She's good with science, logic. She basically can understand stuff when it's taught to her, but she can't read. And so what we're doing is looking into problems with that. And we're looking into one specific problem that causes that. It's called auditory processing disorder. And this girl, she also has, which is typical of auditory processing disorder, having trouble with new words and spelling. And this comes from the fact that spelling words, it's based on phonetics and phonetic awareness and being able to recognize the differences between the sound. What happens with auditory processing disorder is you can't hear the differences between the sounds. So especially if you had auditory processing disorder when you were developing your language skills, you would have problems with learning the difference between the letters, being able to tell them apart, and the whole structure that language is built on doesn't make any sense. And it snowballs from there because if you have trouble with the basics, when you learn higher up stuff, it just causes problems. So I decided to look at this disorder and what would happen to this girl if she was 16 now, and what would be her future in 10 years when she was 26, or if this girl was 16, say in 10 years. So that's pretty much my project and what it's on. Now, the reason why I decided to do this project is because that girl was me when I was 16. I had this disorder. I was actually diagnosed with it at 17. And I wanted to understand what would be happening with people that were like me that were a younger age, not born, what's going on with that. And also find out maybe what type of things would be out there to help me better, because it's processes with the brain. So even if you go through treatment, it tends to come back with stress because when you reprogram your brain, it needs constant reinforcement to stay. Okay, so that leads us to where I started. So I started on my research and I just looked up auditory processing disorder, and I found tons of information, and it was all pretty related to what I was doing. But it was all based for kids, mostly under the age of 7, mostly around 7, 8, 9, 10 years old. Nothing that really addressed teenagers too much, maybe a few things here and there, but definitely nothing that addressed anybody over the age of 18. And my topic was looking at, well, a 16-year-old that was newly diagnosed and a 26-year-old basically. So I continued searching for data, and I was looking up stuff, auditory processing disorder in adults. And that's about when I found out that there's different forms of auditory processing disorder. Now, when you look up auditory processing disorder in adults, you don't find the same disorder talking about in adults. You actually find something completely different with the same name. This is something that people have gotten later on in life, like from an accident, people that were in wars and they had bomb blasts, something that caused brain damage or that has entailed. So they wouldn't be able to understand the differences between sounds. They would start to have that problem. But they've already been through the developmental stages, so they don't have the problems with the reading. They'll have a lot of problems with understanding what people say because they were used to hearing it a certain way and now they're hearing it a different way. where people that have it from a kid, some of them will be having trouble with understanding verbal spoken language, but some won't because they always hear it the same way. Like myself, I always hear the sounds the same way, so I had no problem understanding people. I had problems when it come to encoding and decoding words. I also couldn't separate sounds the same way. These are very common traits. But these are different in depending on when you got it. If you were a kid and when you don't, what actually happens. And so stuff got a little confusing from there with the research because there was pretty much nothing on my topic. And furthermore, I started doing more intense looking at literature, not just what you could find on the general internet, but actually documentations from professional journals and stuff. And I found more confusing that there was really nothing going on, and that there was no language to talk about an adult that had it from a child and had these specific problems that arise from the learning disability. But I continued looking, and I put together a lot of how they were using the language in the everyday talk, how they were breaking up. They were basically breaking up into, the most common was breaking it up into two categories, in adults, in children. And then there was developmental and acquired, and then secondary, which came along with hearing loss. But then they were breaking it up by the types of tests they give. So there was lateral hearing. So there's also a type of auditory processing where you can't tell which direction the sound is coming from, which is even more different. It's kind of like the equivalent of saying I have a skin condition and not knowing whether it's acne or a third-degree burn or a sunburn or a cut. I mean, they're all very different, but they can all be described as a skin condition. But at least with the skin condition, they have other breakdowns of what you can call it so you can find it. Auditory processing disorder, they do not. So it made finding information incredibly hard. Then I went into my interviews and I showed them what I found, and there was a very good response. I interviewed a speech pathologist, an audiologist, and a neurologist. Basically, they all kind of agreed with me. Now, the speech pathologist did say that she doesn't know how they could break it up into subcategories because they don't even have the disorder defined at all. And nobody really knows what it is, and it's pretty much useless to her as working with patients because the information is very, very scattered. It's all over the place. And she knows stuff because she's went through training. And she also said that for the student, for her patients, when they go out, that she needs to make sure that they have proper information about their form of auditory processing disorder before they leave her care, because they won't be able to find the information out there. And she said any good physician will make sure that they have good information and they don't need to go online searching for more information. Now, that's great. But the problem is, which from the other two people I interviewed, is that the majority of the physicians working with patients are not like the speech pathologist. They themselves don't understand the disorder. They themselves are mixed up. They don't know. They're giving the wrong treatment for the wrong thing. And even the speech pathologist said that one of her major fears in this is people using fake treatments that don't really work, or the wrong treatment for the type of disorder. And that came up with the other two as well. And that comes from the fact that it's just all one name for many different things. And there's also, what I got from both of the other two, the audiologist and the neurologist, is that there are being treatments developed for the different types of auditory processing disorder. And for certain problems, for if you're looking at the neurological side, it's broken up, it has to be broken up, it's broken up differently for the research than if you're working on the clinical side. And there's no congruency between them, there's no common language connecting them. So when they're developing these treatments, it becomes a problem because the physicians working with the patients, they don't have the ability to find the information. They don't have the ability to know if this research really connects with what they're doing. And this is a huge problem, and that's one of the things that they need to work on in the field, and they know that they need to work on it, but is really the classification and making it where people can agree. Another thing is that there's cult-like research groups around the different types of how they define the disorder, and they kind of argue with each other, saying, no, it's this way, it's not, that's not right, and they don't realize that they're talking about completely different things. This is something that I learned from the speech pathologist I interviewed. The neurologist that I interviewed, he was telling me that there was 3 studies that were actually showing that any of the forms of the disorder, they could all be used in diagnosis if we could tell if they could hear the differences between sounds. Now that's speech sounds and non-speech sounds. So that's the extent of the background of my information, or a little bit, or at least an overview, but I'm out of time, so I can't really go into more deeply about it. But I hope you understand a little bit more about where we're at now with auditory processing disorder and how it relates to people not being able to find information, and that the future of the field is really, really up in the air, and it's hard to answer questions like where are we going with the different treatments of it, because we can't even really define what it is yet. So that would be the major issue that needs to come in first. And for my next speech, I'll go into a little bit more about how I think different possible futures could speak out. Yeah, all right, thank you.